Dear students, welcome back. In the previous session, we have discussed about bony parts and its surfaces, borders of the tibia. Now, in this session, we are going to discuss about the attachments of various structures to the tibia. Okay, so these attachments includes muscles, ligaments and the menisci which are attached on the intercondylar area, and also some of the relations in the lower end of the tibia on both the anterior aspect and the posterior aspect. All these things we are going to cover in this discussion. Okay, now first we will see the muscular insertions on, and then we'll move on to the ligamentous insertions. First we will see the muscle insertions as well as the origins on the anterior aspect of the tibia. Okay, so as all of you know that this is the tibial tuberosity, and in the tibial tuberosity the upper part of the tibial tuberosity will have some smooth part, isn't it? So that part to that part the ligamentum patellae is getting attached. So this ligamentum patellae helps the pull of the quadriceps femoris, which is transmitted to the tibia through this ligamentum patellae. Okay, so that means here the quadriceps femoris, all these four tendons unite to form a common ligament which is getting attached on this tibial tuberosity called as through ligamentum patellae. Okay, so and sometimes this ligamentum patellae may also extend to the rough lower part of the tuberosity also. Okay, and if you see the insertions which is present on the medial aspect, okay, here you can see some of the three insertions. We'll see from anterolateral part, anteromedial side. So the insertions all, the first one is the Sartorius. It appears as a hockey stick like this. Okay, Sartorius. And if you move on to more medial aspect, the muscle here is the Semitendinosus, and in between them you will have the muscle called as Gracilis. So what are the muscles? Three muscles which are attached on the anteromedial aspect, or Sartorius, Gracilis and Semitendinosus. These normally these three tendons commonly forms a conjoint tendon. So this conjoint tendon is commonly called as pes anserinus. Okay, pes anserinus, and sometimes these three muscles are also referred to as gyrope muscles. Normally, wherever you get the term gyrope, that means it is giving some stabilizing effect of that particular joint. Okay, yes, so these are the three muscles. What are those? Sartorius, Gracilis and Semitendinosus. So these are the muscle insertion we can see on the anterior aspect, that to the upper end of the tibia. In the lower end we can't see any insertions. Okay, so on the anterior aspect towards the shaft, it is giving origin to a muscle called as Tibialis Anterior. So it gives the Tibialis Anterior, arises from the upper 2/3 of the lateral surface of the shaft. So as we know that here we can find the anterior border, isn't it? So anterior border and interosseous border. So we'll have this lateral surface which gives origin to the tibialis anterior muscle. So why it is giving this muscle as tibialis anterior means, though it is originating on the lateral surface, because on the anterior aspect of the tibia we can see this muscle, so for that reason the name of this muscle is given as tibialis anterior. Okay, so on the interosseous border also it gives attachment to the interosseous membrane. Okay, which is also attached to the fibula, forming tibiofibular joint. So this interosseous membrane is further going to attach with fibula. Okay, so these are the things we can observe regarding the muscles on the anterior aspect. 3 muscles are getting inserted and 1 muscle is getting originating. Okay, if you see on the lower end, some of the tendons will pass on the anterior aspect of the tibia, lower end of the tibia. One is so we will see from medial to lateral. So this one is medial and lateral. The first one is the tibialis anterior muscle, and then it gives extensor hallucis. If you see this hallucis means it is going to great toe. So that's what it is present on the medial aspect, and then it is giving origin to the extensor digitorum longus. That means it gives way to the extensor digitorum longus, not origin, sorry. So tendon, and then next tendon is the peroneus tertius tendon. So we know that this muscle is also related to the anterior aspect of the leg, isn't it? Front of the leg. The muscles which are related to the front of the leg is the peroneus tertius also we can consider. Okay. Yes. What are the tendons which are related to the anterior aspect of the lower end of the tibia? Means one is the tendon of tibialis anterior, and then extensor hallucis longus, and then extensor digitorum longus, and peroneus tertius. So these are the 4 tendons which is crossing on the anterior aspect of the lower end of the tibia. Okay, now what are the ligamentous attachment to this tibia from on the anterior aspect? Or so if you see in the upper end, it is giving already it is giving inserted, it is giving attachment to the ligamentum patellae, and then so normally on the anterior side of the knee joint, the knee capsule is not present, but on the lateral and medial side of the patella, it is giving attachment to the retinaculum, which is also having the function of the capsule. So that is lateral and medial patellar retinacula. And if you see more on the lateral aspect, it is giving some attachment to the iliotibial tract. Iliotibial tract. Okay, now we will move on to the attachments on the posterior aspect. So now we will see the attachments on the superior aspect of the tibia. Now here we can find from anterior to posterior. Again here you can find the ligamentum patellae here. Okay, now as we know that in the upper view of the tibia, you'll have an area called as intercondylar area. In this intercondylar area, many structures are getting attached here, and to understand these structures, we are going to divide this upper part into anterior and posterior side. So now we will see what are the structures which are attached on the anterior aspect. That means here this is the structure that is called as medial meniscus. So anterior end of the medial meniscus is attached to the intercondylar area, and then anterior cruciate ligament C. So this is medial meniscus on the anterior aspect, and then anterior end of the lateral meniscus is getting attached, and so this is the anterior attachments over, and then we will move on to the posterior attachments. So here this one is the posterior end of the lateral meniscus, and then posterior end of the medial meniscus, and next posteriorly, so the posterior cruciate ligament is getting attached on the posterior aspect. So to remember this, there is a mnemonic present related to this is, so here from the anterior aspect, so what is the first thing? MCL, that means Medical College Lucknow. Okay, on the anterior aspect. Next, so here LMC, so L, that is lateral meniscus, medial meniscus, and posterior cruciate ligament. Then on the posterior aspect, Lucknow Medical College. So Medical College Lucknow, Lucknow Medical College. So this is the mnemonic to remember this attachments from anterior to posterior. Okay, if you see on the lower end of the tibia, you can find an area for interosseous tibio-fibular ligament as well as interosseous border. Okay, so we have finished the structures which are attached on the anterior aspect of the tibia, and then next one is the posterior aspect of the tibia and upper end of the tibia. Now we will move on to the ossification of the tibia. So in this ossification of the tibia, here you can see some of the very important things. The tibia ossifies from one primary and two secondary centers. The primary center appears in the shaft during 7th week of intrauterine life. A secondary center for the upper end appears just before birth and fused in between 16 to 18 years, fuses with the shaft. So on average we can take 17th year. So the upper epiphysis is prolonged downwards to form the tibial tuberosity. Okay, and the secondary center for the lower end appears during the first year. Okay, and forms the medial malleolus by the 7th year. 7th year it forms the medial malleolus. Okay, and fuses with the shaft in between 15 to 17 years, and the blood supply to this tibia is by the nutrient artery. So the nutrient artery is the largest nutrient artery in the body. It is a branch of posterior tibial artery which enters the bone on its posterior aspect. Okay, that is on its posterior surface at the upper end of vertical ridge. Normally the nutrient artery faces downwards, okay, on the posterior aspect. So these are the interesting things about the ossification of the tibia. In the next session, we are going to discuss about another bone called fibula. Thank you.